All right, welcome back inside Studio B. Joining me now is Dr. Amit Amin. He's an interventional cardiologist, and he's here with the Cardiovascular Institute of the South talking about the heart. Of course, this is National Heart Month this February, so it's good to have you in here, Doctor.
Pleasure to meet you. Thanks for having me.
Yeah. You said you've only been in town about 6 months, so you're still new to the area.
I am. I've loved the area. Just moved here from New Orleans. Finished at LSU in New Orleans, so it's been a great few months here, so with my family. So
yeah, it's great to have you here. Tell me a little bit about peripheral arterial disease, or PAD, and what causes it.
Causes are, unfortunately, age. Unfortunately, the older you get a higher predisposition to have it. Also, the biggest two are smoking, which puts you about a 25% chance of risk. Also, diabetes. Also, other smaller ones. Risk factors include hypertension, high cholesterol. And family history is also another one to be concerned about.
Now, what are some of the symptoms that you can get from PAD? I mean, okay, I may have this issue.
The biggest one is pain and ambulation in your legs, either in your thighs, upper thighs, in your calf muscles. Those are the biggest ones, especially if you start walking, you notice you have pain in your legs, and once you sit down, it goes away, and then continue walking again, it comes back. Other issues include poor healing of wounds in your legs. Normally, wounds typically heal within a few days to less than a week. If you've noticed something on your legs it's gone on for a week or two, maybe more, there's definitely some signs. Poor pulses in your leg, discolorations of your leg, cold extremities. When hair doesn't grow as well as it should, that's another key sign too.
You got some major arteries in your legs, so I guess that's kind of why that's a key thing.
Yes, sir.
What are some of the things you can do if you know you have PAD in your family history?
Something you can do is just either follow up with your family doctor, or you come see us at Cardiovascular Institute of the South. We'll be happy to perform a basic test on you, which is called an ankle brachial indices. It's basically just performing blood pressure tests on your upper extremity and your lower. Calculates a gradient for us and determine if you truly have some kind of blockage. And from then on, we can either do a simple ultrasound, which is painless, and it will help us determine exactly the location where the blockage is.
What's a good age for men and women to go in and start getting tested for this?
50 is a good cutoff, but if you have the other risk factors such as smoking, diabetes, prior heart attacks, which can increase your risk of having peripheral artery disease, and they actually work both hand in hand, that'd be something for just a basic screening of ABIs, which we do. And we do have something coming up on March the 20th evening, which I'll be hosting in the Lafayette office, which is a simple ABI screening.
Awesome. Dr. Amin, good to see you. Thanks
for having me, sir.
Appreciate it. You bet. We'll be back with more. Stay with us.